Good afternoon, everyone, and welcome Rotarians and guests to our virtual Downtown Rotary meeting. I'm Jessie Schmidt, and I'm the current president of the Downtown Sioux Falls Rotary Club. Our guest today is Dr. Eddie Sullivan, the president and CEO and co-founder of SAB Biotherapeutics. Dr. Sullivan is actively involved in charting the vision for the organization and working directly with the scientific and technical staff to develop new innovative products, many of which we're going to hear from about this afternoon. He's worked to form strategic partnerships around the world to promote the development of life-saving therapeutics. As a seasoned biotechnology executive, Dr. Sullivan has more than 15 years of leadership experience. During that time, he's led initiatives to develop infectious disease, cancer, and autoimmune therapeutics. Dr. Sullivan has been a thought leader in this field and worked with various committees and discussion groups that have focused on animal biotechnology, and has actively participated in discussions for establishing a regulatory framework around this technology. We encourage Rotarians to ask questions this afternoon in our Facebook feed, and I want to welcome Dr. Sullivan back. We had him last fall, but in light of COVID-19, and the exciting developments at SAB, it's only appropriate that we would have him with us today. And we have Tony Knorr, our president nominee, who's going to moderate this conversation. But first, we're going to hear from Eric Erickson, and he's going to talk about his mentoring moment. So thank you, everybody, and I look forward to a great conversation today. Go ahead, Eric.
Thanks, President Jessie. And Eddie, I'm glad you're here because that means there's a big crowd watching on Facebook and everywhere else, and it's a chance to spend 2 minutes talking about mentoring. Rotary has joined with many organizations to focus on mentoring for not only kids, but people at every stage of life. So I'm going to give you a 2-minute story. And actually, I'm a little kind of disheveled this morning, even though I'm in my office. I had kind of a rough morning. Here's how it went. I went to bed at my normal time. And sometime about maybe 1 o'clock in the morning, somebody woke me up and said, you have to go to your cousin's house and spend the rest of the night. So I'm confused, and I get in the car and I get over there. And just as I was going to sleep, a baby started crying, and I woke up, and then my cousin had to go to work because he works the night shift. And I don't know, I probably got to sleep around 3:30 in the morning. And well, I slept until 8 this morning because my alarm didn't go off because the power had gotten shut off in the middle of the night. My cousin couldn't afford to pay the electric bill. And so then I ran out the door. There was no food in the house. I couldn't eat breakfast. I couldn't catch the bus because I wasn't at home. So I decided to walk to work, and I rolled in here about 9:30 this morning, and didn't feel a lot like doing my May expense report, if you can imagine. Yeah, it's not my story. I had a normal routine morning. I even came to my office and I drove here and had a hot cup of coffee before I got here. But it is the story of the kid that I mentor. And he told me this story about 6 years ago when we first met. He was in 2nd grade, and I said, why aren't you doing the assignments that your teacher is giving you? And why do you sometimes get frustrated? He said he was tired. I said, well, why are you tired? He told me this story, and it blew my mind. Like, why did you even come to school today? Well, this is a great kid. He's a super bright kid, lovable, and he's curious, and he has every ability that my kids have and your kids have. But he had some challenges that our kids and we probably didn't have. So we've had hundreds of conversations since then, and they've all been meaningful. His mom and his teacher and his counselor at school recognized he needed somebody else in his life, somebody additionally to be accountable to. And fortunately for me, LSS matched me with this awesome kid 6 years ago. And it changed my life. And I can see that it had a huge impact on his life. And it's been worth 45 minutes a week. Mentoring gives teachers and parents and school counselors another resource to encourage a student. And mentoring gives that mentee the stability that they need to succeed and somebody that they can count on. And mentoring gives the mentor a chance to invest in something that is invaluable. And mentoring does not require any special ability. It just requires availability. And if you have that availability, and many others I'm sure that you don't even know, please call 211 if you're in Sioux Falls, or go to sioux52.org, learn how you can mentor and change someone's life. Thanks. Tony?
Thank you, Eric, for sharing. And as Eric mentioned, Downtown Rotary and Rotary throughout Sioux Falls is committed to mentoring and to lifting that up and coming alongside the mayor in his Sioux 52 initiative. So yeah, I would encourage you to find a way to mentor someone, whether it's in business or in Eric's situation. There are a lot of kids on a waiting list that are waiting for a mentor. Let's turn now to our guest today. Welcome, Dr. Eddie Sullivan, President, CEO, and co-founder of SAB Biotherapeutics. This is a company that produces human antibodies to fight disease. And a lot of biotechs make human antibodies, but what makes SAB unique is they make human antibodies through cows. We're going to get to that, but Eddie, before we get to the science, once again, welcome, but tell us your story. How did you get into the world of biotechnology?
Well, Tony, it's good to be with you and with everyone else today, and it's a pleasure to speak to the Rotarians and to the Downtown Rotary. I appreciate the work that this organization does, and the great story that Eric told earlier is so important. You know, I have been interested in science, I guess, since I was little, and I remember my parents buying me a little chemistry set once where you could make clear liquid turn colors and then back to clear, and it just fascinated me. And very early on, and of course through my schooling and through high school and even into college, I knew that science was something that I was interested in. I had the opportunity to do some initial laboratory work, both in high school as well as in college, and it just piqued my interest enough that I stuck with it. And I remember being at my 20-year class reunion. That's been several years ago, but we won't go there. And I remember a lot of my friends talking about the various careers and career paths that all of us had been taking. And when I told them what I was doing, they said, "You mean you're doing what you actually said you were going to do when we were in high school?" And I said, "Well, maybe not exactly, but very close." And so I love it.
Yeah, well, that's great. We're glad that you followed that early tug to chase a career in science. Regarding SAB, if you were to ask the average person where they might go to find a biotechnology company, they might name a city on the East Coast or West Coast. Share the history on SAB and why or how did you land in South Dakota?
Well, it is interesting because the entire project actually started at the University of Massachusetts Amherst many years ago in the late 90s with the idea of being able to produce these fully human antibodies in a large animal species. And you might ask, well, if you were already in Massachusetts, how did you end up in South Dakota? And the reason was because even at the time that we had laboratories on this project in Massachusetts, the animals were here. And one of the things, of course, that makes the Midwest such a great environment for this kind of project is because, first of all, the ag-based economy that we have here in the Midwest. Second of all, this is one of the best places on earth for cattle and for the health of these animals. And we wanted them to be in the best place possible. And then I think there's a third reason. I think we have an environment here in South Dakota in particular that is friendly to business, to startup. There are great people available who are interested in science. And, you know, we can do amazing things here. And we have got to believe in ourselves and believe that we can do it. But in fact, we know that we can. And so this has been a great environment for us to be conducting this work.
Yeah, we're glad you made that decision years ago. Dr. Sullivan, tell us why cows? Often in science, we hear about rats, mice, monkeys. Why did you choose bovine?
Well, one of the important parts of this entire process was the idea of being able to produce fully human polyclonal antibodies. And we'll talk a little bit about that, what that distinction is and what makes this so unique in a minute. But being able to produce these antibodies at a commercial scale was very important. And you can imagine that if you want volume, you probably don't want to choose a mouse, or even a rabbit. We wanted a large animal species. Cows were very unique because there were two reasons at the time. One was an obvious reason. In order to do the genetic engineering that we had to do in order to have the animals produce human antibodies, and then be able to take the cells that we do that engineering in and have them become an animal, that technology existed in cows, believe it or not, cows and sheep, before any of before it happened in these other animals. And so we were able to take advantage of that initial effort in being able to produce these animals in the way that we do. The other thing that's important is that these are ruminants. They have this big bacteria vat that they use for digesting food. And what's so unique about that is that they have an immune system that keeps that bacteria vat in check. And so actually ruminants have a much stronger immune system than monogastrics. And so we take advantage of that much stronger immune system in the process of making antibodies in these animals. And so it turns out that cows, actually we have another project in goats where we're making human antibodies in goats as well. These animals make a very robust production system, so to speak, for making antibodies.
Excellent. That makes sense. And you mentioned in these cows, you're making human antibodies. Help us understand how that works.
So what we had to do was really a two-step process. The first one was to turn off the antibody genes that make cow antibodies. And it turns out that that was actually the hard part. Being able to take a gene and silence it. And not only that, but antibody genes aren't just one gene, there are multiple genes that actually make antibodies. And so we had to figure out in a cow where these genes were located and then be able to target them and essentially turn them off. That was the first part, because we don't want them making cow antibodies. We want them to make the human antibody. The second part was to transfer the genes that make the human antibodies. And we did that in what we call a human artificial chromosome. It's a small piece of human chromosome 14 and human chromosome 2 that have these genes that make human antibodies. And we had to engineer not only the chromosome itself, but also the genes within those chromosomes so that they would produce high levels of human antibodies inside of cows. Now, what makes this so interesting is that because these animals are actually born producing human antibodies, they recognize the human version of antibodies as being a part of themselves. And so they use these antibodies the same way that they would their cow antibodies. But now we can take these antibodies out of these animals, transfer them into a human, and a human says, hey, that's a human protein. I don't have a problem with it. I'm not going to make an immune response to it. And that's what makes this the project that it is today.
Thank you. Dr. Sullivan, you mentioned there moving genes, kind of altering things. For those of us that don't understand science to the level that you do, that may make folks uncomfortable. To the extent that you can you help us, our audience, become more comfortable with that and maybe share the responsibility or the steps that SAB is taking to do this in a responsible way?
Yeah. Before I explain the technical part of it, I want you to understand that in the very beginning of this project, we engaged with ethicists actually at the University of Virginia and several other places. And we actually talked about this idea of transferring genes from humans into animals. Now, this isn't the first time this has been done. In fact, it's been done in mice and rats and rabbits and a lot of other animals prior to us doing it. So there's been a lot of discussion about the ethics associated with that. And there's some very careful guidelines that we undergo, that you're transferring the minimal amount of DNA that does some specific activity. And so that was the first part of it. The second part of it was the genetic engineering itself. And the one thing that you have to understand in order to be able to really get this is, first of all, DNA is DNA, whether it's human DNA, animal DNA, it's made up of 4 base pairs. It's the exact same 4 base pairs for all life. All life is made up of this very unique molecule that codes or is the software for making proteins that make us what we are. And, you know, the fact is, even in nature, that the DNA sequences between animals is very similar. In fact, even in the genes between a human and a cow, even in the genes that are very different, they're only about 86% different, or 86%, actually they're 86% the same, 14% different. If you compare perhaps humans to other kinds of primate species, it's even closer. Most genes are 98% exactly the same, or even higher. And some genes are even 100% identical between species. So it's not that you know, we're going to do something that's making these animals, you know, going to act or become like humans. That's not at all it, because we're very specific at being able to have these animals just produce these very unique proteins that we use to fight disease. And so there's been a lot of effort to make sure that we are doing this in a responsible way, that we are limiting that DNA that's actually being transferred, and that we're doing it for a specific purpose, and a purpose that has a positive effect for advancing human health.
Yeah, thank you for clarifying that or sharing that. What other examples are there of non-human animals being used to create antibodies for humans?
Yeah, so I might mention that animals have been used to transfer their antibodies into humans for a very long time. In fact, it was in the 1890s that a gentleman named Emil von Behring, a scientist from Germany, actually figured out that horses that had been exposed to diphtheria, if you took the serum from those horses, transferred it into humans that were sick with diphtheria, that they actually got better much quicker than if you didn't give them the serum. Now, there was a problem with that, because transferring the horse proteins into humans, the humans actually had an immune response to the serum itself. And they refer to that even today as serum sickness. Even if we don't use serum, if we use purified antibodies, we still call it serum sickness. Emil von Behring received the first Nobel Prize in 1901 in medicine because of his work with this kind of transfer from animals to humans in order to treat disease. Now, since that time, there has been a lot of animals that have been used to make antibodies for humans. We use rabbit antibodies and horse antibodies. Even to this day, there are approved products that are used in humans from animals, actually using animal antibodies. We also have human antibodies being made, as I said, in other kinds of animals like mice and rats and rabbits. But it's been primarily used to produce monoclonal antibodies. And that's a different technology. It has been used since about the early 1980s or so. And that's one technology. But this is really the first time that you have a large animal species capable of producing the entire germline repertoire of human antibody genes in a way that is scalable so that we can make a lot of it.
Yeah, so essentially you're injecting humans with human antibodies, which allows them to not reject those, if I'm understanding that correctly.
That's exactly right. So what these animals are producing are the fully human version of the antibodies that we use naturally in our bodies to fight disease.
Okay. And then Dr. Sullivan, you mentioned monoclonal technology. Your company is known for its polyclonal technology. Can you talk about the differences and why it matters?
Yeah. So monoclonal antibodies are a technology, as I said, that were developed in the early 1980s, wherein you can take antibodies from an animal. It initially was animal antibodies, and they would find a single antibody that would neutralize a disease or that would help in, say, cancer or some other disease. And then they can take the sequence of that antibody, grow it up in the laboratory in cell culture, where that cell culture is just making that single antibody. And that technology still exists today. In fact, it is the largest immunotherapy technology that exists in the world today, monoclonal antibodies. And what that means is that the antibody, if my fist is a disease, the antibody is binding to one place. That's monoclonal. Polyclonal, on the other hand, is the natural way that our bodies fight disease. And it's polyclonal because it doesn't just bind to one place, it binds to multiple places on the disease. And that is the natural way that our bodies fight disease. Now, with monoclonal antibodies, the technology went from just having animal antibodies to then humanizing those antibodies, or making them look more human by changing the sequences a little bit within the antibody. So it still had animal components, but it also had some human components. We call that chimeric antibody. They had components of both human and animal. And then eventually monoclonal antibodies have developed where we can now produce fully human monoclonal antibodies. But our technology represents, as you said, the first time that we can produce the full repertoire of polyclonal antibodies, the natural way that our bodies fight disease, but do so in an animal and not have to use human donors in order to do that.
Yeah, and that's, to your point, what makes SAB unique. If polyclonal antibodies are so good at fighting disease, why aren't others in this space?
Yeah, so there are others that are attempting to make polyclonal antibodies outside of human donors. Most of them, what their approach is taking a bunch of monoclonal antibodies and trying to put them together. The downside of that is that that's not really what we call polyclonal. That's not a natural immune response like what our bodies do. It's a very artificial way of trying to have multiple antibodies that bind to a protein, and doing that in cell culture and then trying to mix and formulate that into the right mixture is very, very difficult. In our case, we're allowing the animals to do that naturally. We represent the first time in history that human polyclonal antibodies were available in a large animal species. And, of course, polyclonal antibodies could be produced in mice and in rats, but I think it would be a little more difficult to get the volumes of antibody that you need from just one cow. The way that they get monoclonal antibodies from a mouse is they take a lymph node from the mouse to look for the antibodies that they produce. And you can imagine how big a lymph node in a mouse is. The lymph node in a cow is the same size as the entire mouse. So it's a different system, and it works very well for being able to produce polyclonal antibodies at scale.
Yeah, thank you. Many of those tuning in today likely heard of Dolly the Sheep. She made big news 25 or so years ago as being the first cloned animal. Was she?
Well, she was not the first cloned animal. There had been clones before. The difference is that cloned animals before were made from embryonic cells. And Dolly really represented the first animal that was produced by taking a skin cell or a fibroblast cell and turning that into an animal through cloning. Now, here's the thing. The founders of the original technology upon which SAB is built actually were in a race with our good friends Ian Wilmot and those at the Roslin Institute in Scotland, and actually produced cloned cows at almost at exactly the same time that Dolly was produced. But here's the difference. Sheep have a 4.5-month gestation and cattle have a 9-month gestation. And therefore, Dolly came first. And so everyone's heard of Dolly, but nobody heard about George and Charlie that came second. And George and Charlie represented the first cattle that were produced by cloning. And actually, George and Charlie while they were produced at the University of Massachusetts, actually ended their days here in South Dakota as part of our company. And they lived to be ripe old men of 12 years old. And frankly, the reason that they're no longer with us is South Dakota winters started getting a little rough on their arthritic joints, and it was time for them to have to go the way of all the world. But George and Charlie certainly taught us a lot, and they were the basis of the technology for producing these animals that now produce the human antibodies.
Yeah, thank you for sharing that, what could have been for George and Charlie. So help us then understand your herd or your animals here that you have just outside of Sioux Falls. Those would be cloned versions then of the science that was behind George and Charlie?
Yeah, they actually are. It's a similar technology. We've actually advanced the technology since either Dolly or George and Charlie were produced, but it's the same type of technology. And because we do the genetic engineering in these skin cells or in fibroblast cells, we have to have a way of then taking those genetically engineered cells and turning them into animals. And we do that through cloning. So all of the animals that we have are actually clones. And the way that we can make sure that we're going to have consistency in our product and all of those things associated with that is that all of our production animals are actually clones. So they have identical genetics, they have the exact same human antibody genes in them, and they're producing that antibody consistently.
Thank you, that's fascinating. Given the mission of SAB, I'm going to presume that you began monitoring the COVID-19 outbreak earlier than most of us. What can you tell us about those early days, when you learned about it, and how SAB was prepared to respond?
Yeah, Tony, we first of all, we started a project with the Department of Defense last year, prior to the pandemic or prior to any of us hearing about COVID-19, certainly. And the entire premise behind that project was to develop this technology that SAB represents into a rapid response system wherein we could go from an unknown to producing a product for clinical trials in a very short period of time. And so we were actually working through that project of showing that our technology could do this when, lo and behold, we found ourselves in the middle of a worldwide pandemic. Now, as far as when we began monitoring this, I will tell you that on January 2nd, we came back from the holidays and we had an executive committee meeting here at SAB, and our chief medical officer said, hey, there's something happening over in China that we need to keep our eye on. And so over the course of the month of January, we started monitoring what was happening. And by the end of January, the alarm bells were sounding here at SAB that we could have something very serious happening. And so it was the beginning of February that we started initiating our network of individuals that we work with to take a look at this and see what was going on. And immediately, what we needed to do was to be able to, first of all, identify the virus and the sequence or the RNA or DNA sequence of the virus. And that allowed us to then start formulating, because we have to make vaccines for our animals to the virus in order for them to make antibodies. We have to make vaccines first before there are even human vaccines available. And so we immediately started down that path of being able to determine what we could give our animals to have them make a good antibody. And this entire project with the Department of Defense set us up to be able to respond very rapidly. The second thing that helped us be able to respond rapidly is that SAB actually has the most advanced coronavirus therapeutic in the world right now. That's to the Middle Eastern Respiratory Syndrome coronavirus. It's different than this one. It acts differently. In fact, it has a much higher mortality rate, but thankfully it does not transfer from human to human nearly as easily as the virus that causes COVID-19. And so we had already developed an antibody and had it in the clinic prior to the COVID-19 pandemic. But this gave us a lot of information as a head start to get started with producing the SARS-CoV-2 or the COVID-19 antibodies.
Yeah, thank you for sharing that. We have a few questions coming in, which we'll get to here towards the end if we don't cover them in advance. But you mentioned the Department of Defense. Help our audience understand why the Department of Defense.
Yeah, so we were working on this rapid response system with the Department of Defense. You can imagine that for the military that deploy people all over the world, that any kind of global disease or disease, even in other parts of the world, have concern to the military for the safety of military personnel. You know, not only because we don't want them sick when they're on duty in places all over the world, but they return home to their families and everything else. And so the possibility of being able to bring something home is of concern. And so the Department of Defense is always actively involved in being able to produce therapeutics to whatever's happening around the world. The other component to it, though, is that we also have a relationship with an organization called BARDA, the Biomedical Advanced Research and Development Authority, which is a part of Health and Human Services in Washington, D.C. Our COVID-19 project thus far has been actually one of the first projects being conducted simultaneously between BARDA and the DoD. It just so happened, though, that it was much easier for us to get the project started off of our DoD contract because it actually existed. And so the initial funding actually came from BARDA to the DoD and then to SAB through that contracting mechanism. And so we are working with both of these organizations for both the military use as well as the civilian use in order to bring this product forward.
Yeah, thank you. You touched on it earlier, and I want to come back to this. I think this is important for our audience and for all of us to understand. You talked about, or what we've all learned over the last 90 days is a lot of talk in the news about viruses mutating. We've learned that. We hear about the potential for a flare-up in the fall, maybe more than one strand of this coronavirus. Talk about your technology and why you're positioned when you talk about polyclonal technology to really be a good solution for this.
This is one of the advantages that SAB has over all of the other technologies that are being deployed in this area, particularly to develop therapeutics. You can imagine that, as I said, monoclonal antibodies that only bind to one place on the virus, or even small molecule drugs that may have activity to just one place on the virus. If the virus mutates in that area, that drug no longer becomes effective. But with a polyclonal antibody that's binding to multiple places, what we find is that the virus can't mutate all of those places and still be what it is. And we've learned a great deal about this from our influenza program, where we have been able to vaccinate the animals with strains of influenza. In fact, we use the same strains that are used for the seasonal vaccines for influenza, but sometimes those vaccines don't get it quite right, and we end up with a different strain that's circulating because we're hyper-immunizing these animals and getting these antibodies to be very potent and very powerful against the virus. What we find is that when the virus mutates a little bit, that in fact our polyclonal antibodies still cover and still neutralize that virus. And that's exactly what we've actually seen with the virus that causes COVID, because we have two different strains already wherein one of them has mutated from the original virus that was found in China. And we've shown that our polyclonal antibodies neutralize these two different strains of the virus identically. And so that's why we feel that we have an approach that's going to be very, very helpful as one of the tools in the toolbox for fighting this disease.
Yeah, and others agree. Just last Thursday in a press release that I'm guessing a lot of our audience has had a chance to see, you're about to begin a clinical manufacturing of your COVID-19 therapeutic. Tell us about the next steps and what you can expect from your team over the summer. And in terms of timeline for getting this therapeutic out to the masses, what does that look like, Dr. Sullivan?
Yeah, so yes, we are, as we speak, currently in production of the clinical material that will be used in the clinical trials. That's being produced right here at SAB, here in the Sanford Research Center. We've got a great team of people that are working on this, and quite frankly, my team has been working tirelessly for 3 months. I just had one person that asked if she could have Memorial Day weekend off because she hadn't had a weekend off since this started. And of course I agreed, and we had a little break, and she needed a break, and it was time. And so our team is doing some fantastic work. Of course, that production that production of the antibody itself is the first step. Then we have a bunch of quality control and quality testing that has to be done in order to ensure that the product that we have produced is safe and it's going to be safe for humans. That takes a little bit of time. And in the meantime, we're doing some other testing as opposed to the normal way that drugs would be developed, where you do one thing and then you go to the next step and then the next step. We're actually doing all of the steps all at the same time and moving it forward as quickly as we can. We have to do this in order to be able to respond rapidly, but ultimately we have to submit all of this material to the FDA while they are working fast and furiously to also be able to look at all of the other things that are coming in to do clinical trials. They are not compromising on the safety of the things that we are using in order to treat this disease. And so we have to give them all the information that we normally would have to do in order to ensure the safety of what we're going to give to people in these clinical trials. Of course, efficacy can only be shown ultimately when we're conducting the clinical trials, and we want to do it right. So what that means is we are doing everything to get everything ready that we have to do, and then we hand it to the FDA, and then they get to determine when we start the clinical trials. Right now, we're expecting to start as quickly as possible in early summer.
Right. Thank you for sharing that. I know a lot of our audience is curious around timelines. We'll talk a little bit more about that here after a bit. But we talked a lot about the antibodies that you're creating. We talked about the vaccine. You're not creating the vaccine, you're actually creating the treatment. But correct me if I'm wrong. So this technology that you're creating through your cows has a temporary lifespan in humans. Help us understand the role that your therapeutic will play in our fight against COVID-19.
Okay, so here's the difference between what we're doing and vaccines. Vaccines are actually given to us so that we produce our own antibodies, so that when we get exposed to the virus, our bodies have already seen that and we can immediately respond and produce the antibodies to help us overcome that. Vaccines have some issues associated with them. First of all, not everybody responds well to vaccines and gets high enough antibody titers that they're well protected. And so we kind of look at it that you need both: a vaccine that will help to prevent illness and treatments that will help to treat the illness. Now, what makes this different is the cows are the ones being vaccinated in our case, and we're taking the antibodies out of the cows and then using that, yes, specifically to treat people who have the disease. And then it can also be used initially to treat first responders. And what I mean by that is these antibodies can be given to people prior to getting the disease in order to prevent them from getting it. So as immediately when we put these antibodies into people, they are instantly immune to the virus. So that would be helpful for first responders. But as you said, the antibodies are not part of the patient's natural production of antibodies. And so over time, these antibodies will decrease to a point where they're no longer effective. And then you could either redose, or hopefully we'll have vaccines by then that can be used to help people generate their own antibodies. So we're looking at it in both ways. We know that the elderly population is one of the most severely affected by this disease. We've seen that in Seattle with the long-term care facilities and in other places, in New York and other places. The elderly typically do not respond well to vaccines. And so this may be an alternative to vaccines that can be given if an outbreak occurs in a long-term facility. You can give the antibodies to the other patients to prevent them from getting it. So that's another area that we're looking at as potential for this. Initially, we will be looking at how these antibodies treat people that already have the disease.
Yeah, excellent. So you've mentioned then, so you're taking those antibodies from the cows. We've heard in the news of other companies taking antibodies or plasma from humans to treat other humans. Talk to us about the scalability of that, and then also the potency of what you're producing versus what we get when we draw plasma from a human.
It's a great question, Tony. With what we're doing, we're actually comparing the antibodies that are coming from this cow to antibodies from patients that have had the disease. And what we know is that in fact, most people don't generate high enough antibodies when they are sick with the disease to actually use their antibodies to transfer into patients. Now, some do, and that's what we're using for the convalescent plasma. Interestingly, what we're finding is that we screened a lot of patients that had recovered from COVID-19, and we selected one that had the highest antibodies we could find. This was work that was actually done at the University of Pittsburgh. And we compared our antibodies from our animals to that particular sample. And it turns out that ours was 4 times more potent than the highest potent antibodies we could get from a recovered patient. And so we think that this is going to give a consistent source of really highly potent antibodies, again, in these large animals. And we simply make more by vaccinating more animals, right? And we can do that. We've got a lot of these animals that are here and now and that are being born even as we speak. And so we're going to continue to produce more and more of this as we go through these clinical trials, so that we have enough that once this is approved, we can use this to treat patients.
Yeah, talk to us about that. We had a question come in from one of our Rotarians. You mentioned earlier the gestational period of a cow. Maybe talk about and you've been at this for a while, your herd as it's been historically, and then what needs to happen with that herd. I mean, we're talking about the globe here for us to be able to scale up and provide a solution at scale.
Well, first of all, in the past, SAB had a very small herd, and the reason we did is because we only used 2 animals for initial clinical trials of any particular target that we're looking at. It just so happens that last year we did a large scale up of animals as part of that rapid response work that we were doing with the DoD. In fact, not only did we start scaling up the number of animals, but we actually had a sea change happen at SAB on the efficiency at which these animals are produced. We actually had a 10x increase in efficiency of producing these animals because of some work that we did over the last couple of years. And so we began producing not just, a few of these animals, but actually a few hundred of these animals. And in fact, this year alone, we will have some 220 of these animals that will be born. Interestingly, we've modeled the worldwide need for influenza antibodies. And that's, I'm taking it from this model because quite frankly, we don't know what COVID is going to do yet. So we're just using influenza as an example. We are able to produce the entire worldwide market in between 60 and 80 head of these animals for influenza. And that's for severe or hospitalized influenza. So just because you get the flu, you're likely not going to get our product because most people obviously recover very nicely on their own. And so this is for severe hospitalized influenza. And so that gives you an idea of the scale. And we know in South Dakota that 60 or 80 animals is kind of a small backyard herd, right? So as far as being able to scale up for the number of animals that will be needed for this, really not a problem.
Yeah, great. Thank you for sharing that. Dr. Sullivan, recently SAB was awarded funding from the federal government. Talk to us about the challenges that you've had in the past. You've been at this for years. And just share about and this gets back to the monoclonal versus polyclonal conversation that we had earlier. You just share with our audience what that journey has looked like for you and what SAB has done to navigate that.
This is a really fascinating story, but because there were no technologies that existed previously where you could produce fully human polyclonal antibodies outside of humans, when we would apply or would even look at applying for funding through the Department of Defense or any of these other government authorities, all of the requests for proposals stated monoclonal antibodies. And so, in fact, it completely excluded us from participating in the competition for funding in order to do this. And we spent years trying to get those people to recognize that our technology represented a technology that could potentially rapidly respond to emerging disease using polyclonal antibodies, and that if they would just take out the word monoclonal and just say antibodies, then we could compete. And I remember having a conversation with some folks at the Department of Defense, actually just a little over a year ago, and I was ready to give up, quite frankly. I thought I will never be able to get them to understand that if they just take that one word out, we could compete. And I walked into a meeting and I was ready to full well tell them at the end that I'm done. We have done the best we could, but we can't get you to listen, so we have to move on to other things. And we walk into the meeting, and in the opening remarks, the head of that particular division said, we're going to change our RFPs and take out the word monoclonal because in hindsight, it has been a mistake to exclude your technology. And I thought, oh, meeting done. Thank you very much. I'll go back to South Dakota with a smile on my face now. Well, that's exactly what they did. So the very next RFP that they put out excluded the term monoclonal, and we applied, and guess who won? We won that. We won that, and that is, in fact, this rapid response project that we have with DoD that has now led to our response to COVID-19. And so sometimes you just can't give up. You have to just keep trying until you actually get someone to hear you.
Yeah, well, thank you for your persistence and for helping to shine a light on South Dakota. I can feel the energy from you, even though that was a year ago. I can tell you're still excited by that, and glad that you finally had that breakthrough. It had to be frustrating all those years on the outside looking in. Dr. Sullivan, as we wrap up here, he's got a couple more questions. We might have a couple from our audience. Talk to us about your partnership with CSL Behring.
Sure. So CSL Behring, and it just so happens that earlier I talked about Emil von Behring, and it turns out that that CSL is, at least a part of CSL, is the historical company started all those years ago through the work that Emil von Behring conducted in being able to transfer these antibodies from animals to humans. And so that's fascinating to us that we're now working with this company. CSL Behring is a company that is, in fact, the largest producer of human plasma and human-derived human antibodies in the entire world. And so the partnership with CSL actually started prior to the pandemic again. And we had a couple of projects that we have been working on with CSL Behring. And it's great to work with a company that already understands polyclonal antibodies and understands the process that we use in order to produce them. At least it's a similar process in being able to take antibodies from human plasma and purify it versus what we're doing from the cows. And so we had already started this collaboration with them. And then when COVID came along, we are now working with them. And this is really great because just making the plasma from the cows, we can take care of that. But the scale up of the purification of the antibodies is the one thing that we've had some major concern about, because we have to scale up so rapidly in the case of responding to COVID-19. And so CSL also has manufacturing capabilities, obviously, to be able to purify antibodies from plasma. And so we are working with them to produce some of this antibody, at least in part in their facilities, and then in facilities that we have here in South Dakota as well. So that has automatically, more than doubled our capability to process that downstream material.
Yeah. That's great. And a question came in from Rotarians. You talk about being able to scale up to get your therapeutic to the world, to those that need it the most. Are there any cases that you know of today that folks just wouldn't be a good fit for your therapeutic?
Well, it could be. It would probably be people that have a specific allergy to beef. That could potentially be something that might be of concern. But for the most part, there should not be very many individuals at all that would not be eligible to do this. Obviously, one of the things that we have to keep in mind is that disease progression matters. And certainly the earlier that you treat, the better. And that's the case for almost any treatment. And so COVID is an interesting disease that we're only beginning to learn how it affects the human body and how it affects perhaps people even differently. And so certainly we know that there will be times when probably no therapeutic is going to be helpful if somebody has advanced too far in the disease, and that's terribly unfortunate. But as far as any other exclusion criteria or something of that nature, we and those that we work with are not aware of that currently.
Mm-hmm. Yeah, and you mentioned the Middle Eastern respiratory disease that you worked to put together a therapeutic for. This is COVID-19 is the first big one in our lifetime. Probably safe to say this may not be the last one. It sounds like what you're doing today in terms of scaling, you're going to be even faster to a therapeutic in the future. Can you talk to that?
Yeah, that's the entire premise behind what we were doing in developing a rapid response system with the DoD. And certainly, I think, given the economic devastation of this pandemic, and frankly, there have been warnings for years that something like this could happen. And I don't know, when everything is going well, no one likes to think about the dark days that could happen in the future. And we often will neglect preparation for those dark days. But certainly this has been a lesson learned. And all of us need to take that lesson and figure out what we can learn in order to be able to respond more quickly, in order to be able to protect our economic environment and all of the other things that are associated with what we're learning through this pandemic that, as you say, is the most serious pandemic that has happened in our lifetimes, but it may not be the last, and we need to remember that.
Yeah, thank you. And Dr. Sullivan, earlier you shared, and we'll just 5 minutes left for those that are sticking with us, and thanks for tuning in today to Downtown Rotary. Earlier you shared that you knew at an early age you wanted to pursue a career in science. You've been at this for a while now. What does it feel like for you, a biotech entrepreneur and scientist, the work that you're doing to potential to make a huge difference in a global pandemic that's threatening 8 billion people on this planet?
Well, I think I've told this story before, that I once said that if I worked my entire career and was able to help one person, that it would be worth it. And we had an experience like that with our mycoplasma project that we conducted with Harvard Medical School at Brigham and Women's in Boston, where we took a very serious infection that an individual had, and we were able to make antibodies to it and actually were able to cure that infection that this person had for more than 7 years, and nothing would get rid of it. And that happened, and we were able to restore, at least in part, a quality of life for that individual for some period of time. And that was very rewarding. But being able to be involved in something that could literally help millions of people is something that I think is also rewarding. And I guess maybe you get a little bit greedy if you have one success and you want to help more people. But I'll tell you that most of the people that work here at SAB, they do this, and they're working so hard because we really do want to help people. And I remember when we decided we were actually going to get in and invest in developing a potential therapeutic to COVID, I said, if we're going to do this, let's do it in a way that we don't delay one day, not one day. Let's do everything we can to get it done as quickly as we possibly can and not delay one day. And that's what my team has been attempting to do, because one day could make the difference between life and death for one individual or perhaps many individuals. So that's been our goal, not one day delay.
That's great. Thank you. Dr. Sullivan, for those in our audience who might be anxious, who themselves or someone they love might be in a high risk category or vulnerable situation, we also have a lot of business owners that are downtown Rotarians, and our country is predicated on small business and the ability to pursue our dreams. There's thousands of millions of people around the world. Us in South Dakota, we're watching whether it's a vaccine or a antibody therapeutic. We're looking and we're waiting. And to your point, you don't want to give up a day in this. What message of hope do you share with those that are out there watching the progress of SAB and others that are racing towards a cure or a vaccine?
No, this isn't the first time that the world has faced a serious threat, whether it's through a pandemic, a virus, or war, or other things. And somehow we are resilient. And while COVID-19 is something that's new, that's perhaps frightening to us in some ways, there are diseases out there that we live with every day, including influenza, that kills almost as many people on a yearly basis as what we see with COVID-19. And over time, we learn to live with these things. There will be vaccines developed, there will be treatments that are developed, and we will be able to move on. And I think that one of the things that all of us need to do is reflect on the response that we've had to this disease, to be able to understand that ultimately life will return to some sort of normalcy. I don't know how different it's going to be than prior to the pandemic, but hopefully over time we will learn how we live with COVID-19 as a part of our life. I guess the best case scenario would be that it would disappear next week, and I think that would be the best case scenario. But if that does not happen, then we have to continue on and be able to live with it, and ultimately that's what I think we all have hope for.
Yeah, thank you, Dr. Sullivan, for sharing that. And just in closing here, I saw that the World Health Organization recently named SAB Biotherapeutics as having the best therapeutic platform to address priority infectious diseases with epidemic potential. I want to say congratulations to you and the team on that. It should make all of us South Dakotans proud to know that that is happening right here in our backyard with employees that are from this part of the country. And we will be cheering you on throughout the summer and into the fall and watching for additional news coming. But I want to thank you for joining us, sharing your team's work, pursuing your passion, your career in science and biotechnology. And I speak for Rotarians in Sioux Falls and around the world and saying we're grateful for you and your team, and we wish you the best and I encourage you to keep up the good work. And with that, I'll just say God bless to our Rotarians. Have a great week, and we look forward to having you join us next Monday. Thanks.